Hey guys, Dr. Kilfoyle here with Podiatry Explained. I'm here with Dr. Jenna Friedman, and today we're going to be talking about Aaron Judge's turf toe. Now, a few weeks ago, he was trying to catch a fly ball and went smashing through a gate, and he hit his foot on an unpadded part of the field, and what many speculate is turf toe. So here we are, two podiatrists, and we're going to be discussing the intricacies of this injury, so stay tuned. Hey guys, Dr. Kilfoyle here with Dr. Jenna Friedman.
Hi.
And today we're going to be talking about one of the more common injuries we see in sports, in football and baseball, in the context of Aaron Judge, the New York Yankee. So let's dive right in. We're going to be talking about turf toe. A true turf toe injury is when these bones right here, called the sesamoids, they're on the bottom of the metatarsal phalangeal joint right here. There's some very, very thick ligaments that connect these two bones together. Some are on the side, some are on the top, some are on the bottom. The bottom ones have to be really thick. Just think about it. Your knee is really big, your hip is really big. That same amount of weight has to go through these little tiny bones. So the ligaments have to be super thick. A true turf toe injury is when there's hyperextension, meaning that the toe goes up in the air and it rips the ligaments away on the bottom. Now, if you look at the mechanism of injury, when you watch him slam through that fence, there may not have been a true hyperextension. Some guys speculate because the doctor hasn't released the MRI, Aaron Judge hasn't released the MRI, it's not our right to know that stuff, but just looking at it, we can see that there was probably some kind of medializing force, which may have interrupted the medial collateral ligaments and also the plantar ligaments. So we're just going to be talking about turf toe in general because we don't know exactly what happened to his toe, but we do know he's injured, and they just lost their best player on their team.
So turf toe gets its name from when people are running on a turf surface, which is more artificial than grass, and I guess it's less forgiving. And it typically happens when the big toe hyperextends, really dorsiflexes up, which damages those bottom ligaments that we were talking about before.
Right. So the name came from when especially football players would, they'd be playing on turf. So it's artificial grass, and when they would push off, their foot would get stuck, their cleat would get stuck in that thing. It led, their brain wasn't used to that kind of surface to be running on. We've been running on natural grass most of our lives, and then when you get to the big leagues or you get to college level, you're playing on turf. And that's where that injury's name comes from. There's also something called sand toe, right? Yes. Sand toe is a hyperflexion of that joint. So this is turf toe, this is sand toe. And that happens to people who are playing, beach volleyball or something like that. So after this injury, you can see he's limping. He's probably got a little bit of adrenaline. You watch him turn around and look at that curb that he kicked. So he was evaluated by, from what I hear, lots of different doctors. None of them are revealing too much information about it, but they're saying that he could be out for months. But when it comes to surgery, there is only a couple different cases. So let's go through the classification system of turf toe injuries. So stage 1 kind of turf toe injuries is just a sprain. What's the difference between a sprain and a tear? Well, a sprain is when the ligament is actually stretched out, but it's not torn. Stage 2, or grade 2, is when it's partially torn, and grade 3 is when it's fully torn. When a turf toe injury is grade 3, it can these sesamoid bones won't be in the area that they belong, and you would need to be surgically corrected. So luckily for Mr. Judge, which I assume this is his case, again, we don't know the exact details of his MRI or his imaging or anything like that, I imagine he either has 1 or 2, which could mean that he does not need surgery, and 2, he will need 3 to 4 months of immobilization and treatment. So that means the rest of his season's done. Well, the season's almost over, and they sucked this year. So no harm, no foul for the team.
So some of the usual treatments that we do when it's just conservative, not surgical, we recommend something called rice therapy, which is when you rest, ice, compress, and elevate the foot as much as you possibly can. Really try to stay off of it. You want to go through some physical therapy, someone who could really help you work around that muscle, work around that injury. And then, using the special type of foot gear, whether it be a supportive shoe or an orthotic or some sort of offloader, just to help you really cushion that area.
Now, I don't know what orthotic he might have been prescribed, but if I had to prescribe something, I think I would go for a stiff-soled shoe, something that doesn't crush like nothing, like not like a ballet slipper. It would be something as stiff as can be, and I'd want something with an exaggerated 4-foot rocker. If you ever put a running shoe on a flat surface, you'll see that the tip of that shoe is kind of off the ground. You can even put your fingers underneath it. And that's, if it's stiff and has that 4-foot rocker, that means that the joint doesn't have to bend as much for you to propel yourself. Those two components would be the kind of orthotic that I'd want for him to have. And if he wanted to have any more reinforcement, so he could even be stiffer inside that shoe, you can have like a Kevlar or even a steel shank built into a orthotic, and so that there is literally no motion possible at that thing. That's all short of non-weight bearing and crutches or a cast, a fiberglass cast.
So if Mr. Judge was a stage 3 injury, which again, we're not anticipating, but if he was, you'd want to do some sort of surgical intervention for that. So what you'd be doing is fixing that ligament structure underneath those tiny little bones in the foot, those sesamoids. Mm-hmm. So you'd be fixing those and then maybe even reconstructing the joint just to provide a little more stability over there.
Right. So if you wanted to do surgery for him, not only would you have to then cut the skin, and which would need stitches, you'd have to access the ligaments inside the toe, and then if it hasn't already healed, which it's already been weeks and weeks and weeks, you'd have to repair those things back together. And at this point, it's probably already scar tissue has filled in, and we'll see what happens with him. But surgical repair is necessary if it's a complete tear and those sesamoids are displaced, which we assume is not the case for him. Thanks for joining us today on Podiatry Explained. Hopefully you guys got to see how podiatry can be involved in some of the most interesting injuries that the sports world has to offer. Please like and subscribe for more content, and thanks for watching. Have a good day.